So hello guys, with the ongoing lectures on the medicine and pediatric instruments, now we have reached on the laryngoscope. So as you can see in this diagram, this one is metallic, one is laryngoscope, and these are the endotracheal tubes. So in the another diagram you can see this is how the endotracheal tube is inserted with the help of laryngoscope. This one is the laryngoscope with the help of which we introduce endotracheal tube. So it has a handle and the blade. This one is the handle, this one is the handle, and this curved one is the blade. It can be curved or straight. In the case of it has blade has two types, straight as well as curved. Straight in the case of neonates and curved in case of older children or adults, right? We have the curved oropharynx and then further, right? So we can use this used in the non-dominant hand, as you can see in this in this doctor. How it will demonstrated is with the help of non-dominant hand, the doctor is holding what? Laryngoscope, and with the help of dominant hand he or she is able to insert the endotracheal tube, right? Uses is to insert the endotracheal tube in it, right? So next is endotracheal tube. So again the endotracheal tube is further of two types, cuffed or uncuffed, right? Cuffed tube is used in the to prevent the aspiration. So with whom we inflate the cuff, right? This is as you can see in this diagram, this one is basically cuffed, right? We can inflate it. So we can inflate it with the help of what? Air, water, saline, what? We can inflate it with the help of air, right? Remember this point, right? Now how to identify that this is the endotracheal tube? Both its ends are open. Both its ends are open. Proximally uniform bore, right? Lead line is present over it, right? And thicken, right? There is a thickened black marks amount of tube, minimum it should be inside, so that black mark is not visible, right? Normally. So this is not that clear in this diagram. Okay, how to ensure that you are in the vocal cords, right? Give oxygen. Now auscultate, as we can do same in the case of insertion of the Ryle's tube to confirm that this enters in the stomach, right? Here we give oxygen, right? There what we give? Air only, right? Give oxygen, and now auscultate both the lungs, right? If both the if there is air inside both the lungs, then it means what? Endotracheal tube is at the right position, that it is in the inside the vocal cord, right? If in esophagus or abdomen is distended, then the Ryle's tube the endotracheal tube goes in the esophagus, right? Then the abdomen will distend, as we can give the oxygen, right? If in one lung there is a good air, but in the other lung there is no oxygen, there is no sound we can hear on auscultation, right? So what is this, right? This is that you have gone very inside the bronchus, right? If in one lung good air, means you go in bronchus, therefore slightly pull back so that you can reach in the vocal cord and ensure that both the lungs have adequate air exposure, right? So definitive for this is X-ray. There the position is in between the clavicles. The endotracheal tube should be present in between the clavicles. So now you will tell me how you can see endotracheal tube on X-ray. So as I already told you, this is because of the lead lines, right? Lead line is present on the endotracheal tubes. This will help, which is visible on X-ray, and this will help it